Good afternoon. My name is Lynette Roach, and I'm the Director of Media Relations for Black Health Matters. Welcome to the session for Heart Attacks 101. In the United States, someone has a heart attack every 40 seconds. About 1 out of every 5 heart attacks are silent, meaning that the damage is done, but the person is not aware. Individuals who suffer from high blood pressure, heart disease, and diabetes are at an even higher risk of having a heart attack. Luckily, we can decrease our chances of having a heart attack by preventing and treating certain diseases, along with knowing the signs of a heart attack beforehand. I'm pleased to present Dr. Mir Babar Basir. Dr. Mir Babar Basir completed his cardiology, interventional cardiology, and complex and high-risk interventional, or CHIP, training at Henry Ford Hospital and Wayne State University in Detroit, Michigan. Dr. Basir is currently a senior interventional cardiology staff at Henry Ford Hospital, specializing in the treatment of complex coronary interventions and the use of advanced mechanical circulatory support devices. He serves as the director of the STEMI program and the director of the Acute Mechanical Circulatory Support Program at Henry Ford Hospital. He is the co-principal investigator for the National Cardiogenic Shock Initiative, a multi-center prospective single-arm study evaluating the use of early hemodynamic support guided by invasive hemodynamics in the treatment of acute myocardial infarctions complicated by cardiogenic shock. It's my pleasure to present and introduce Dr. Mir Babar Basir.
Hi, Lynette. Thank you so much for giving me the opportunity to speak with everybody today. And to the audience, thank you for taking your time. I hope that the entire program helps to serve you and your family's needs and increase health awareness throughout our entire community here in Detroit. Today, I'm going to be talking a little bit about a very strong passion of mine, which is how we care for patients who present with heart attacks. And I'm the director of the heart attack program at Henry Ford Hospital. So the objectives of today's talk is I'm going to try to be able to help answer 5 questions in the short time that we have today, which is to describe the burden of heart disease in America today, describe what causes a heart attack, how to prevent a heart attack, how to treat a heart attack, and then I want to spend some areas where we've been actually performing a little bit of research here in the Detroit area about identifying and overcoming the disparities that we have in heart disease today. So, as Lynette really eloquently put it, the burden of heart disease is very significant, both within the United States and in particular within the Black community, as well as other minority and immigrant communities as well. So every 25 seconds, an American has a heart attack. We have around 700,000 new heart attacks every year, and just under 500,000 people have recurrent heart attacks. Unfortunately, we have 1 in 3 people who die from heart disease or stroke, and that is why it's the leading cause of morbidity and mortality in the United States. We know that there's a lot of things that we can do to be able to help prevent heart attacks from occurring, but we also know that the audience has had a lot of questions in regards to how to be able to accomplish this, and we hope to be able to give a little bit more information on that. By participating in this program, you're already part of the minority of people who actually care about making sure that they're in a heart healthy condition. So as you can see from the graphic from the American Heart Association, 44% of patients actually monitor their blood pressure outside of their doctor's office. But 60% don't know their blood pressure or their cholesterol numbers. 56% of adults have been told by a healthcare professional to improve their health. 83% of people believe that heart attacks and strokes can be prevented, but they aren't motivated to do anything. 72% don't consider themselves at risk of heart disease, and 58% put no effort into improving their health. And that's something that we really feel strongly needs to change within our communities. So, what causes a heart attack? Well, there's multiple different ways, but the most common scenario is what's described as atherosclerosis, or hardening plaque within the blood vessels of the wall. So you can see in image one, that's a normal blood vessel. You can see the nice color of the blood vessel. And what ends up happening is over time, as we get older, the cholesterol that we eat and that's produced by the liver slowly starts um, um, depositing within the blood vessels of our body and forms plaque. Now, what ends up happening in some patients, those in particular who have heart attack and stroke, is that the plaque starts to accumulate and actually disrupts the normal function of that blood vessel. And certain disease states can actually lead to tearing of that cap of the atherosclerosis, or the plaque. And whenever your body sees that plaque, it tries to clot it off. And by clotting it off, you actually cause a blockage in your heart. You decrease the amount of oxygen and blood that's circulating to the heart, and you have what's called a heart attack, a myocardial infarction. So, what can we do to prevent a heart attack from occurring? Well, we've talked a lot during these sessions about diet and exercise. And I think that those are clearly the two standalone most important things that we can do. But there's a lot of us who are already have risk factors that have developed for heart disease. And so, what can we do as people who already have health issues in preventing a heart attack? Well, first, if you're a smoker, smoking cessation is probably the number one leading thing that we can do to actually prevent a heart attack. It decreases our risk by over 30%. So it's better than any medication that you can actually take. Number two, if you have high blood pressure, you can actually treat that blood pressure. And people with high blood pressure are at 50% more risk of developing a heart attack. If you have a high cholesterol level, particularly your bad cholesterol, which is called your LDL cholesterol, treating that with medications such as statins helps reduce the inflammation within the blood vessels and helps stabilize the plaque so it's less likely to rupture. If you have diabetes, the diabetes can actually disrupt the plaque wall and cause it to rupture. It also helps in increases the risk of the plaque burden developing within your blood vessels. And so having really tight blood sugar control is very important. And one of the things that we don't talk enough about is really limiting stress and anxiety. Those are two key things that we can do to actually prevent plaque from rupturing. If you actually look at pathological studies, many people, the majority actually have plaque built up over their blood vessels after the age of 65. However, not everybody has a heart attack. Well, why is that? Well, many of those reasons that we just listed about preventing heart attacks are some of the things that those people do to kind of not have those. And so it's really important to keep these things in mind. Now, let's talk a little bit about those of us who have already had a heart attack. So, what happens when you have a heart attack and you have this heart blockage? Well, there's a couple of ways to treat it. So, firstly, what we do is we treat with medications such as cholesterol medications, statins that help reduce the inflammation in the blood vessel. We also use medications like aspirin, which thin the platelets or the blood so that they're less likely to adhere to that plaque, and so that you're less likely to develop that blood clot that would lead to a heart attack. If medications are not enough, then we have to potentially go on to actually fixing the heart blockage. And that's done in two major ways. One is what I do, which is to treat blockage with balloons and stents. Here, what we're doing is we're squishing the plaque to the side of the blood vessel, allowing for the blood flow to down the heart to continue as normal. And then the stent is actually drug coated and prevents recoil and keeps that blood vessel from collapsing within on itself. It's a very, very good tool, and more studies are being done that actually show the benefit of actually stenting blocked arteries as well. The second option that we typically do after early stabilization is with patients with complex heart blockage that may be better served with bypass surgery, particularly those who are diabetics. They can actually get an open heart surgery to be able to treat their blockage. And that's when we take blood vessels from the shoulder or from the leg and we implant them within the heart, bypassing the blockages that are present and restoring blood flow down the heart. We usually do this not in 100% blockage, but in blockage which is less than that. So, what I thought was important for the audience to know is, what if you or your loved one has a heart attack? What should you expect in this situation? Well, you're going to have chest pain. There was a great lecture earlier today about the signs and symptoms of a heart attack, so I won't go over that. But as Lynette mentioned earlier, you can have silent heart attacks, which are much more difficult to treat because patients don't seek early intervention. If you do experience chest pressure and pain, signs of a heart attack, you call 911 as quickly as possible. You will have EMS take you to the nearest hospital that has a cath lab available. That's where we typically put in balloons and stents. You'll meet our physician team within the emergency room. They will treat you with aspirin, with heparin, which is a blood thinner, and then they will activate the cath lab based on your EKG. So if you present to the hospital, it's standard of care if you're having chest pain to get an EKG within 10 minutes. And this EKG shows us if someone is having an acute heart attack where the blockage is 100%. And if that's the case, I get called in emergently. We usually put a small catheter that you see here through your wrist. We bring a catheter to your heart and take pictures. And then we open that area with a balloon and a stent and restore blood flow, treating the heart attack. And in 98% of patients, they have no troubles or problems after the heart attack. They see their medical providers and ultimately go home. And that's what we want for everybody as well. Now, I want to switch gears a little bit and talk to you about what I study and what I help to teach people from a medical level as well. So my research interests lie in cardiogenic shock, and that's when you have really large and big heart attacks to the point that the muscle of the heart is so weak that it's not able to adequately send blood to the brain, to the kidneys, to the liver, to the organ system. And when that happens, we typically treat patients by fixing the heart blockage, and we use pressures inside of the heart to be able to help us guide on decision making about whether to use support devices. These are artificial heart pumps that we put in percutaneously, meaning to say no major surgeries, just small punctures in the legs typically. And then we put the heart pump in to be able to help the heart recover and to send blood from the heart to the rest of the body. And so this was a paper that was going to get published in the next couple of weeks that was accepted to JACC Intervention. And what we showed is that women of all racial ethnicities, as well as Black and Hispanic men, have significantly worse mortality when it relates to these very large heart attacks. And that is because they get care in terms of fixing the blockage, which is called revascularization, MCS, which is the actual pumps themselves, and then pulmonary artery catheters, which are the tools that we use to measure the pressures in the heart. that there is decreased use of each of those interventions in women and minorities, and it's something that we need to improve on. One of the ways to improve on this is to actually standardize the care of patients who present in this really sick state. And over the course of the last 5 years, we've developed the Cardiogenic Shock Initiative, which has been a Detroit-led national initiative where we've created an algorithm and a protocol to follow when patients present with heart attack that has resulted in cardiogenic shock or really, really big heart attacks. And with this work, we've been able to actually improve the survival nationally from about 50% of patients who would survive their hospital stay to about 70% in patients who would survive their hospital stay. And it's really a dramatic improvement. And so we've actually now launched this nationally. We know all of the major hospital systems in Metro Detroit have been following this algorithm for the past few years. And I'm really proud of the work that we've been able to do in this regard. So to conclude my talk, heart attacks are frequent. They occur in Black and brown persons at a higher degree and are associated with more complications. A healthy lifestyle and treating underlying illnesses can prevent a heart attack. If you or a loved one experience a heart attack, you must seek medical care quickly. The longer you wait, the more muscle is damaged and the harder it is to treat and to recover that muscle. There are significant disparities in the care of Black and brown persons in the United States, and standardized care can decrease these disparities and improve outcomes. And lastly, I encourage everybody to seek second opinions and have detailed conversations with your healthcare team and providers. Advocate for you and your loved ones. I see patients with some of the most complex heart blockage within the country. We typically have not been able to help, we've been typically able to help the vast majority of patients who come into our offices. I've realized that it's really, really important to advocate for you and your loved ones, to seek a second opinion so that you know all of the options that are available to you. We have a very robust heart transplant program, a hemodynamic support program with artificial heart pumps, and then really complex heart blockage solutions as well. So thank you so much for your time. I'm happy to spend a few minutes answering any questions anybody has. This is my email if I can be of help to anybody else. And I will quickly stop sharing my screen. Thank you so much. All right. So let me open the question and answer. And for the first question, what is the difference between a heart attack and congestive heart failure? That's a fantastic question, Lillian. So a heart attack is when a blockage occurs within the blood vessels that supply the heart, and congestive heart failure can occur because of a heart attack. In fact, it's one of the leading reasons people develop congestive heart failure. But congestive heart failure is when the heart muscle becomes weak to the point that it's not able to send blood to the rest of the body. It can also occur, congestive heart failure, for reasons outside of having a heart attack. And we have really fantastic solutions with medicines, and in certain people who are qualified for it, these artificial heart pumps and transplants to be able to help restore normal heart function. So thanks for that question. Question number 2 is, how important is individual responsibility versus social determinants of health in regard to heart disease risk and protective factors? That is really a great question by Allison. It's a hard question to answer on this call because it's I would need a little bit more time to be able to answer it appropriately. But I think it's very important, meaning to say that individuals have specific risks that are really can even be genetically driven. So high cholesterol, early heart disease is very known to be or very responsive to genetic abnormalities. And then these social determinants about how we take care of ourselves, what we eat, if we smoke and do all of these things are also critically important to heart disease. So both have an important factor. Question number 3 was, how does diabetes contribute to plaque buildup? The way that it does that is because the high blood sugar, it actually causes increased inflammation within the blood vessels. This actually occurs outside of just the heart alone, and in fact is basically associated with any of the blood vessels of the body. And so diabetics have an increased risk of stroke, heart attack, and peripheral vascular disease. Now, the last question here is, how much of a factor does family history play in things like high cholesterol or high blood pressure? It does play a tremendous role. There are very important genetic diseases that can cause high cholesterol. And if you or your family know that you have one of those diseases, it's important to start a prevention strategy earlier rather than to wait for the complications such as a heart attack or stroke from occurring. That's the end of my time. I want to just thank everybody again for tuning in. Thank you so much to the organizers for putting this together. If I can be any help, you have my email address, and please visit the Henry Ford booth. Thank you so much.